Elaros 24/7 is a company that puts patients at the heart of monitoring and managing their health. Through its commitment to innovation, Elaros 24/7 has developed a new and effective service that provides quick, accurate and cost-effective assessment of lower urinary tract symptoms.
It reduces the need for patients to be going backwards and forwards to GPs. It provides GPs with a very quick assessment of what's wrong with the patient. It adheres very tightly to the NICE guidelines and cuts down on inappropriate referrals by 35%, reducing pharmacology costs by probably close to 10%.
It's also easy to use and patient-friendly.
Low urinary tract symptoms are extremely common in the population, affecting both men and women. If you look at the older age groups, the level of symptoms reaches up to about 60 to 70% of the population.
What you find is people can be depressed, they can be upset, they stop doing things, and I have actually known 2 people who've said it's made them feel suicidal. So it can be devastating how controlling it is.
It's very important for clinicians to use a bladder diary to adequately assess these symptoms. At first sight, a paper diary is very straightforward. The problem with it is a lot of people find it impossible to integrate this into their clinical practice, particularly at primary care level.
As a result, primary care staff may refer to specialists to try and achieve the best patient outcomes. The Elaros 24/7 service provides a quick and cost-effective solution to this problem. It begins by giving patients an electronic bladder diary called a Euro Diary to record their urinary activity.
Well, the Euro Diary that I've used with patients, it's dead easy to use. You just press the buttons on the screen. It tells you clearly what to do. There aren't too many choices and it saves everything. So it is very easy to follow it, to use it, to document what you need to do to give to the clinician. And you've got this discreet little box. Looks just like a mobile phone.
The Euro Diary can hold many days of data and is also very secure. When the patient returns the Euro Diary to the clinician, the data stored on it is uploaded to EuroConnect, the Elaros 24/7 bladder diary management system. This performs an intelligent analysis of the data and then provides clinicians with an accurate assessment of the symptoms.
In general practice, sometimes we have to refer people along to the hospital simply so somebody can look at the urinary diary. Yes, you've obviously got problem X or problem Y, this is what you do. With this system, we can do that without them leaving the practice. The great benefit to us as general practitioners is that the recommendations that we get from our screen are absolutely guideline based.
Because EuroConnect is an online service, it reduces the need for local IT support. It also allows prompt communication along the clinical pathway and allows clinicians at different locations to access patient data. This delivers a truly comprehensive system for the assessment of lower urinary tract symptoms.
Elaros 24/7 is a company that's been created by clinicians, comes out of the NHS, has 3 NHS organisations involved with it, 2 universities on board. We're working with patient groups and we are working with a range of other commissioning and provider organisations.
Elaros 24/7 uses all of this knowledge and experience to make it easy for clinicians to meet NICE guidelines whilst reducing workload.
It's reliable, the patient found it easy to use, and then for me, it's very easy to get all the analysis and have everything down electronically.
It's more convenient to the patient. It's helpful to us as clinicians, and also for the NHS, it's cheaper because we don't have to refer people into hospital.
It gives us a huge amount of information and allows us to effectively and accurately evaluate and treat people.
To find out more on how Elaros 24/7 can improve assessment and monitoring of lower urinary tract symptoms whilst at the same time reducing workload, visit www.elaros247.org.uk. Elaros 24/7, making continence more dignified.